Hi everybody, I'm Matt Aaron, the President and CEO of Special Olympics Pennsylvania. We've been working really hard on our return to activities plan, and we're so excited to be able to resume training and activities very soon. Safety is always our number one priority, and to be safe, everybody has to do their part. So I thank you for taking the time to watch this important video, and we can't wait to see you again soon.
I understand I could be exposed to the coronavirus through sports, training, competition, and or any group activity at Special Olympics. I am choosing to participate in sports, competition, and or other Special Olympic activities at my own risk. During the time these precautions are needed, I agree to the following to help keep me and my fellow participants safe.
If I have COVID-19 symptoms or have been near someone who had COVID-19 in the past 14 days, I will stay at home and not go to any activities until 14 days after exposure or 7 days after all my symptoms are over, unless I have received a clearance from the healthcare professional. We all should be aware of the symptom of COVID-19. However, you could have COVID-19 and not have the symptoms. So, people could spread COVID-19 to others by the air of the respiratory droplet and not even know they had COVID-19. That is why it's so important to wear a face covering and stay at least 6 feet away.
Special Olympics gave me education on Special Olympics rules for COVID-19 and who is at high risk. Who is at high risk, you may ask? COVID-19 is a new disease and information is changing on who is more likely to get COVID-19 and who will have more complications. Based on currently available information and clinical expertise, people with intellectual and developmental disabilities are at higher risk of severe illness resulting in death from COVID-19.
I know that if I have a high-risk condition, I have more risk that I could get sick or die from coronavirus. If I have a high-risk condition, I cannot go to Special Olympics Pennsylvania in-person activities until there is little or no coronavirus in my community.
I know that if I have a high-risk condition, I have more risk that I could get sick or have serious outcomes from COVID-19 until there is little or no coronavirus in my country. If I have a high-risk condition, I know I should not participate in person at Special Olympics events.
I know that before I participate in Special Olympics activity, I'll be asked some questions about symptoms or exposure to COVID-19. My temperature may also be taken. I will answer truthfully to all questions and participate in. When I arrive at Special Olympics practice or event, I'll be asked a few questions. Let's review the question that all participants will be asked. In the last 14 days, have you had contact with someone who has been sick with COVID-19? Have you had a fever in the last week, temperature of 100.4 Fahrenheit, 37.8 Celsius or higher? Do you have a cough and or difficulty breathing? Do you have any other signs or symptoms of COVID-19? Fatigue, muscles or body ache, headache, new loss of taste or smell, sore throat, or runny nose, nausea or vomiting, diarrhea? I might even need to have my temperature.
This is what 6 feet or 2 meters looks like. Another way to think about what 6 feet or 2 meters is by imagining a door laying flat, the length of a bed, the size of a dining room table, a couch, or the width of a car.
I will wear a face mask at all times while at Special Olympics activities to help slow the spread of the coronavirus. I may not need to wear a mask during active exercise. Let's look at the proper way to wear a mask. First, you will need to clean your hands or hand sanitize them before putting it on your face. Make sure the mask covers your nose and your mouth and hook it over your ears. When you remove the mask, make sure you don't touch the outside of the mask. Unhook it like that.
I will wash my hands for 20 seconds or use hand sanitizer before any Special Olympics activities. And if I cough, sneeze, go to the bathroom or get my hands dirty.
Let me show you the 6 steps to effective hand washing here. First step, wet your hands. Second step, apply soap. Third step, wash your hands for 20 seconds. Don't forget to scrub between your fingers, under your nails, and the top of your hands. Step 4, rinse well with the tap running water. Step 5, dry your hands. Step 6, turn off water with paper towel.
I will avoid touching my face and will cover my mouth when I cough or sneeze and immediately wash my hands after.
I will not share water bottles or towels with other people.
I will only share equipment if instructed to. If equipment must be shared, I will only touch the equipment if it is disinfected first.
If I get COVID, I will not go to any in-person Special Olympics event until 7 days after my symptoms end. Also, I will go to my doctor and get written clearance before returning to any sport or fitness activity.
The risk of infection, not necessarily serious illness, with COVID-19 is higher for people who live or have recently been in an area with ongoing spread of COVID-19. If you traveled or plan to travel to a state other than Pennsylvania or a country with an ongoing spread of COVID-19, you must notify your training site COVID-19 coordinator. The training site COVID-19 coordinator will immediately refer to the Department of Health website. If the state or country listed under COVID-19 information for travelers, then you must quarantine for 14 days upon return. The same notification requirement applies if you traveled or plan to travel to a yellow or red phase county in Pennsylvania. The training site COVID-19 coordinator will immediately refer to the Department of Health website. If the county is yellow or red on the COVID-19 early warning monitoring system dashboard, then you must quarantine for 14 days upon return.
I understand that if I do not follow all these rules, I may not be allowed to participate in Special Olympics during this time.